Hi everybody, my name is Ryan Feckret. I'm an undergraduate chemistry student at the University of California, Irvine. And today, in cooperation with the INA Foundation and with special focus on the connectivity of our mind and body, we're going to be discussing this article by Jillian L. Goldfarb in the New England Journal of Medicine, titled Beyond the First Dose, COVID-19 Vaccine Follow-Through and Continued Protective Measures. The premise of this study and associated article I'd like to share with you is that the vaccine relief efforts, while improving following new incumbents, changing policy, and overall seemingly changing efforts for the populace as a whole to acquire vaccines, there is, for reasons to be discussed, pushback regarding the acquisition of second doses. The introduction of new vaccination options, such as Johnson & Johnson's single-dose vaccine, offers consumers a choice that may help combat hesitancy, but this development, in combination with the discussion of delaying second doses of the other vaccines, Pfizer and Moderna, may exacerbate public confusion and uncertainty over two-dose regimens, thereby undermining total efforts to ensure that as many Americans as possible return to receive that second dose. This problem could be particularly acute for racial and ethnic minority groups who are disproportionately susceptible to attrition with multi-dose vaccines. This is a phenomena that is recorded in historical data as well. In our survey, Black and Latin respondents, of which comprised 24% of the total polled, were significantly less likely than white respondents, of which comprised 43% of the total polled, to believe that Pfizer and Moderna vaccines offered strong protection by 1 to 2 weeks after the second dose, and were more likely to report being unsure. Failure to combat second dose attrition among the members of these minority groups risks magnifying pre-existing racial disparities in the virus's human toll. So, to explore the strengths and limitations of current outreach to vaccinees, the investigators asked respondents who had already received at least one dose of a COVID-19 vaccine about the information they recalled being provided when they received that first dose. This is the results of that. While 85% of vaccinated respondents reported being informed that they needed a second dose, only 54% recalled being told that protection was strongest after the second dose. That nearly half of vaccinated respondents could not recall being informed about the timing of protection may help explain why vaccinated respondents did not differ from unvaccinated respondents in their answers to the preceding question. An identical percentage of each group believed that the Pfizer and Moderna vaccines offer strong protection before the second dose. So, as you can see, crafting guidance is necessarily a balancing act between encouraging vaccinated people to continue practicing prophylactic behaviors to protect themselves and others, and ensuring the public that vaccination offers tangible benefits, including, but not limited to, a slow but sure return to normalcy. However, a substantial proportion of the vaccinated people reported not being informed about core CDC guidelines and recommendations for continued protective measures after vaccination. Only 31% of vaccinated respondents reported being told that the risk of transmission from vaccinated people to others is unknown. This is a key impetus for continuing to practice protective measures in public settings. Only a slim majority, 61%, reported being told to continue wearing masks. Similarly, 56% were told social distancing and 53% about avoiding crowds. These findings suggest that there is a real need and opportunity for the medical community to provide fuller guidance and greater contextual explanations to vaccinees about how life can change after vaccination as we gradually return to normalcy. Finally, the authors examined the correlates of support for continued post-vaccination mask wearing. Aggregate support for this prophylactic measure was high. 21% agreed, and 60% strongly agreed that continuing to wear masks is important. But support varied substantially among these subgroups. Those over 60 years of age, Black, and already vaccinated respondents were more supportive of mask wearing, all else being equal. In keeping with the current political polarization regarding many aspects of pandemic response policy, they also found a substantial partisan divide, with Republicans being significantly less supportive of continued mask wearing than Democrats. Finally, respondents who believed that vaccinated people cannot transmit the virus, that is 7% of the total, were least likely to support continued mask wearing, followed by those who were unsure about transmission risks, of which was 39% of the total. Despite current efforts, many Americans, including many of those who have already received a first vaccine dose, remain confused about the timing of protection and the necessity of a second dose. Moreover, a large proportion of vaccinees reported being uninformed about CDC guidelines regarding the need to continue to take prophylactic measures, including mask wearing and avoiding crowds. Finally, these results have identified demographic groups who are most reluctant to accept these measures and who would benefit the most from targeted outreach that they aren't receiving. Vaccination campaigns must not only address concerns about product safety, and this goes especially for groups that claim to be anti-vaxxed, but must also provide clear guidance about vaccine benefits. For example, the reduced likelihood of contracting severe disease from COVID-19. Historical rejections of past public health strategies may also influence attitudes and beliefs regarding COVID-19 vaccination, though communications that focus on misinformation should be at the core of these strategies. Educational strategies must also focus on building trust first and foremost, and informing the public about the science. Such efforts are especially important in light of existing mental models of infectious disease and biases that can affect public acceptance of scientific information and fuel that vaccine skepticism. These challenges may be particularly acute when it comes to novel technologies like mRNA vaccines. Augmented educational efforts for vaccinees at the time of the first dose also hold considerable promise for combating second dose attrition, clarifying that the risk of transmission from vaccinated to unvaccinated person remains uncertain, and bolstering compliance with critical public health guidance that minimizes general health risks and provides the fastest possible transition back to that normalcy. All of this is to say that there is an ignorance that can prove dangerous to the public where educated providers perhaps lack the support, network to educate, or altogether preach to deaf ears. At this time, the information portion regarding that article has concluded, and to finish this presentation, I'd like to share with you also my experience not only getting twice vaccinated, I fall under those with pre-existing conditions, but also being familial with someone who refused to get vaccinated. First, on my vaccine experience. I went to get vaccinated at a CVS pharmacy. I waited in line with adequate social distancing measures instantiated before I arrived, and those same social distancing measures were enforced by staff on site. The wait to get my shot was short. I received both vaccines on an appointment basis. It didn't hurt when I did get my shot, and the vaccine was administered both times by the pharmacist. Afterwards, I had pain at the site of injection. The first shot hurt more than the second, and both carried with them symptoms that lasted no more than 72 hours, and then after that, those symptoms were gone. Of course, I continue to practice social distancing and continue to wear a mask when I go outside, but on the topic of the themes related to the study, I was not informed at all when I received my first dose of prophylactic or post-phylactic measures to avoid contracting disease or spreading disease. After my second dose, the timeline, nothing. Now for my familial friend that was refusing to get vaccinated, the way I explained it to them and the way I encourage you to share your knowledge with the friends and family you hold dear is to not be abrasive. No amount of name calling or fighting is worth ruining your relationships with those you are close with. Simply educating others on the pros and cons of not getting vaccinated, in my experience, is enough to sway the tide, or at the very least, show that you care. And if not, the best thing you can do is to provide them or anyone with a strong knowledge base to make their own educated decision. And so I leave you with this: be smart, make smart decisions, and be safe. I'd like to thank the INA Foundation and the New England Journal of Medicine for providing us with the basis of this presentation and platform. And thank you to those of you who are watching and listening. Your interest in these subjects and in listening and watching these presentations is what fosters these outlets for students like myself in this pandemic, and for those medical professionals working tirelessly in our community for our sake. So, thank you again, and goodbye.